I'm going to talk about another aspect of the annual physical exam that's really important to keep people healthy as they age. And one of those is doing a cancer screening. The number one cause of death in the United States is heart disease, but the second most common cause is cancer. So obviously we want to catch cancer before it causes death, and we definitely prefer to catch cancer, while it's fully treatable. So cancer screening should be part of your annual exam, and there are certain aspects of cancer screening that change as you age. So at every age, someone should have an annual skin check. This is actually best done by a dermatologist, but at least talking about making sure that annual skin check gets done should be part of every visit, even with your primary care provider. And if you have anything on your skin that you're worried about during your annual exam, even though your primary care doctor is not a dermatologist, you should still have them look at it so they can guide you as to how fast you should make your appointment with a dermatologist, whether it can wait or not. So that's for any age, including, kids and people in their 20s. They should be considering an annual skin check. Another screen for cancer that we like to do every year at the Akasha Center, it's a very general, non-specific cancer screen that we like to get on our blood panel. It's called lactate dehydrogenase. So lactate dehydrogenase is an enzyme, and the levels will go up in your bloodstream if you have a tumor growing in some organ, no specific organ, but if there was a tumor growing and pressing on the cells around it, those cells would release an enzyme called lactate dehydrogenase into your bloodstream, and it would look elevated on your blood test. So if we get an elevated result back, what we want to do is start looking for what might be a tumor growing somewhere. There are other reasons for an elevated lactate dehydrogenase, so you need to have your doctor really guide you to the process if that comes back elevated. Another screening that is really important is for women starting at age 40 is to get an annual mammogram. And if you have dense breasts, this should be accompanied by breast ultrasound that helps you find breast cancer while it's very early and treatable. Another very important cancer screening for people age 45 and up is a colonoscopy or colon cancer screening. The colonoscopy is a gold standard because colon cancer can be both found in its precancerous stage, which is called a polyp, and removed during the colonoscopy all at once. So it's really considered the gold standard. There's a lot of people who are scared of a colonoscopy and don't want the colonoscopy, but they still want to have a cancer screening. So there are some other methods like Cologuard and different stool-based tests that are pretty good. They're not as accurate as a colonoscopy, but they definitely will give you some answers and at least will let you know whether it's worthwhile to go through with a colonoscopy, because if a Cologuard is positive, that means you definitely need to have a colonoscopy just to look and see what's going on, because there's probably a polyp there. So that starts at age 45. Between 45 and 50 is when people should have their first colonoscopy or colon cancer screening. That changes depending on your family history, so it's something that you can discuss with your primary care doctor. As far as lung cancer screenings, that really depends on your family history, your own personal medical history. So if you have a history of tobacco smoking or secondhand smoke exposure for a long period of time, like in the house you grew up in, or if you have exposure to environmental pollution, then you might have a lung cancer screening with chest x-ray. But some people will not have that done because they don't have any risk factors, and so it's not universally done. So that's a conversation to have with your doctor. Another important screening is for cervical cancer. So fortunately, the incidence of cervical cancer for upcoming generations is decreasing because of the HPV vaccine. So the HPV vaccine helps prevent cervical cancer because 99% of all cervical cancer is due to the presence of the HPV virus. By vaccinating kids against HPV, by the time they're adults, they're less likely to have funny-looking cells that turn into cancer on the cervix if they've been vaccinated. You were supposed to start having your cervical cancer screenings with a pap smear starting age 21, and that's been moved up to age 25 due to the vaccine making it so unlikely to find a cancer between 20 and 25. Really don't need to screen until 25. And then the American College of OB/GYN says if your pap smear is normal and HPV negative, you can spread out your pap smears every 3 years. You don't have to have them annually. However, we have a lot of patients who prefer to have it annually. And the reason why is because it's a cancer screen, and they're living their lives and loving their lives, and they don't want to risk missing something that could be treatable in the early stages. And that's very understandable. Another cancer screening that is done, especially for women who are on bioidentical hormone replacement through either perimenopause or menopause, would be for endometrial cancer. So the endometrium is the internal lining of the uterus. And the internal lining of the uterus can be stimulated by estrogen. So if you are on bioidentical hormone replacement, which is estrogen and progesterone, that's molecularly exactly the same as what your body makes naturally, it can stimulate the lining of the endometrium to grow. And so you want to make sure you haven't stimulated any abnormal growth or masked any possible growing cancer. And the way we do that is with an annual endometrial ultrasound, also called a pelvic ultrasound. So if you're on estrogen and progesterone, you should have once a year a pelvic ultrasound, in addition to your once a year mammogram to screen for breast cancer. So let's not forget prostate cancer. The first screening that they'll have is probably just with a blood test. It's called prostate-specific antigen, and it just goes on their annual panel. It's a way to measure the likelihood that the prostate is growing abnormally or abnormally fast. You want the PSA to be less than 4.0, and you also want to make sure it hasn't doubled from year to year, even if it's still under 4.0. So if it was 1 year and the next year it's 3, even though that's still under 4.0, it's still too fast a growth. So it's a way for us to monitor the prostate for prostate cancer. This is especially important if someone's on testosterone replacement therapy, because testosterone can stimulate the growth of the prostate. So we do check a PSA, a minimum of once a year, but sometimes twice a year if someone's on testosterone. There's also a prostate exam that is given during the physical exam. And this has to do with feeling the prostate to make sure it still has a smooth contour and is the normal size and location. Other cancer screenings are really more directed by patient history or symptoms, and therefore not done on every single annual exam.